looked at, or we used a data set from a clinical trial conducted in the mid-2000s, where 78 patients with early RMS, they were followed for 2 years with regular measurements of serum neurofilament light chain and MRI examinations. And then 10 years after the original study was concluded, they all participated in a 10-year follow-up visit where MRI examinations and clinical tests were repeated. So we looked at the serum neurofilament light chain levels during the original trial and their association with clinical and MRI measurements at the 10-year follow-up visit. And we also sort of split these neurofilament light chain levels into two, so non-inflammatory or inflammatory. And the way we decided that was to see if there were gadolinium-enhancing lesions present or recently present in relation to that, to the separate neurofilament light chain measurements. So what we found was that the inflammatory neurofilament levels were associated with a lower total gray matter volume, deep gray matter volume, thalamus volume, and cortical thickness after 10 years. Higher levels were also associated with a higher T2 lesion count. And then when we looked at the non-inflammatory neurofilament levels, we did not find any of these associations. So from this we think that these increased neurofilament levels during active inflammation can possibly be a way for clinicians to sort of quantify the severity of a relapse and possibly from that say something about the risk for that patient to develop brain atrophy and clinical disability in the future. I think for this it was a pretty low sample or a small study population, so it would definitely be good to repeat in a larger cohort, and also with the nature of our imaging material, it was not possible for us to look at the actual longitudinal change, so we only used the cross-sectional data from the 10-year follow-up. So to also look at these inflammatory levels and longitudinal change in gray matter volume would also be very interesting.